So Neighbourhoods, it's really about community. Across City and Hackney, it's about providing care for populations of between 30 and 50,000. We use this number of population because it's small enough to provide person-centred care, but large enough to be able to deliver services for people at that level. We have lots of great services in City and Hackney, and we are really very lucky. But what Neighbourhoods are about bringing those services together in an integrated and coordinated way and thinking about new ways of working for the future. We're very lucky that we've got the backing of all providers and commissioners across City and Hackney. Who does it involve? The voluntary sector, charities, our residents and our patient panel, GP practices, community services, children's services, pretty much everyone and anyone that you can think of. It's a great example of integrated care in action, because the aim is that for the person, for the patient who's receiving care, those people working with them and around them will be joined up, will be coordinated, there won't be duplication. Take an elderly gentleman who has multiple health problems and also needs carers to support him at home. There won't be 4 visits from 4 different people on the same day who aren't talking to each other as well as they could be. There will be one response, and all those working around that person will know what each other are doing and responsible for. We now have 8 neighbourhoods that have been named after parks. There's huge amounts of engagement in reaching those names. We have data profiles for each of the neighbourhoods, so really looking at who makes up the neighbourhood, what their needs are, and how we can support them for the future. There's also some exciting pilots happening around social care, community nursing, the voluntary sector, which will be rolling out over the next 12 months. We also have an incredibly engaged and dynamic patient panel who are overseeing and supporting us with all the work that we do, making sure that we have the residents and patients at the heart. So what's next for Neighbourhoods? One of the key areas we'll be looking at next is focusing on what we call the broader determinants of health. So thinking about education, housing, green spaces, the impact that this has on people's health and well-being, and what we can do to make things better for the future. Neighbourhoods are a really good example of the integrated care system, bringing together partners City of London, London Borough of Hackney, as well as NHS Health and Care Services. And this is being done in a really forward-thinking and proactive way. And I can definitely say that City and Hackney are ahead of the curve.